Hi, my name is Saskia. I'm a psychological wellbeing practitioner, and I thought I'd make this video today as a kind of quick beginner's guide to OCD. So many people know what OCD stands for, but I'm going to say it here. It's Obsessive Compulsive Disorder, and it's an anxiety disorder that features unwanted thoughts that pop intrusively into the mind. So these are called obsessions, and that can lead to the performance of repetitive behaviours called compulsions, which are aimed at reducing this anxiety. And while compulsions can lead to short-term reductions in anxiety, many people with OCD report that both their obsessions and their compulsions in the long term lead to significant distress and often interfere with their daily lives. And again, many people with OCD report that whilst they understand that a lot of the time their behaviours are maladaptive or they don't make sense, they can't consciously change these behaviours without the help from a practitioner or a psychologist. So OCD is actually a pretty commonly experienced disorder. So one or two in every 100 experience OCD every year. So like I said, pretty common. However, due to frequent inaccurate media portrayal, there's a lot of confusion surrounding OCD. A lot of the time in the media, it's oversimplified as a desire for cleanliness or orderliness. And this oversimplification is pretty damaging to people with OCD because it can cause confusion and a lack of support in people with OCD themselves, but also around, in the general population. So as I said, I'm going to make this video as a quick beginner's guide to OCD, and I'm going to outline the causes, the symptoms, the treatments of OCD, and hopefully that will give you an idea that OCD is a lot more complex than the media often portrays, and hopefully give you a bit of a better understanding. So let's begin. So regarding the causes of OCD, there's no one single cause of OCD. Like many psychological disorders, there can be multiple risk factors involved, which vary in between individuals and affect these individuals differently. Some of the risk factors that have been linked to the onset of OCD include family history. So in a family with one or more confirmed cases of OCD, this has been linked to further OCD cases, so the onset of OCD. And it's thought that this may be due to family shared beliefs, beliefs about responsibility, how personally responsible you are for others, and also about what your actions and thoughts say about you as a person. So thoughts, shared beliefs in particular, for example, I am personally responsible for ensuring that others are safe, have been linked to the onset of OCD as well as the number of cases in a family. Another risk factor is biological causes. So problems with neurotransmitters, for example, serotonin and norepinephrine, have been linked to the onset of OCD. However, the biological causes in regards to genetic factors have a lot less research supporting this. There have been some genes which have been linked to like the onset of psychological disorders as a whole, but no specific genes have been linked with OCD. So the biological causes tend to be more related to problems with neurotransmitters rather than genetic factors. And finally, critical incidents. They are probably the most prevalent triggers to OCD. So things like stresses or challenges, they can often lead to OCD, because especially those that lead to an inflated sense of responsibility or an inflated sense of being a loss of control. So a lot of evidence in the research suggests that abuse and trauma can specifically lead to the onset of OCD, and with compulsions acting as coping mechanisms for this trauma. So these three are kind of the main risk factors which have been spoken about in research regarding OCD. So now we've spoken about the causes of OCD, I'm going to move on to the symptoms. And just like with the causes of OCD, OCD does not present the same way in all people. However, in most cases, the symptoms of OCD can be broken down into components of obsessions and of compulsions, and I'm going to speak about some of the key manifestations of OCD in terms of these components. obsessions are repetitive and persistent thoughts, urges, or impulses that pop unwanted and intrusively into the mind of people with OCD, and they provoke feelings of anxiety because often they are unpleasant in nature. There are loads of different obsessions involved in people with OCD that vary from person to person, but they do tend to follow common themes. So some of the main obsessional themes I'm going to explain now. So probably the most common one, which is portrayed in the media, is a fear of contamination. So this obsession is often portrayed in the media as excessive hand washing and excessive cleaning and that kind of thing. However, the actual obsession involved is a fear of contamination, and that could be of yourself, of others, through bodily fluids, through germs, through disease, through chemicals, and that kind of thing. So that's one obsession theme involved in OCD. Another theme is sexual, so unwanted sexual images that pop into the brain, sexual thoughts about children, obsessing over sexual thoughts about men, women, homosexuality, and that kind of thing. Another obsessional theme is religion, so a consistent worry about offending God or a concern about morality. That's another obsession. Another one is losing control or harming others. So a lot of the time, some people with OCD will worry about not being careful enough and then that causing harm to another person, or accidentally hurting someone else and being personally responsible for that. And finally, the last kind of obsessional theme I'm going to go into is perfectionism or symmetry. So this is a real concern with preciseness, with exactness, with orderliness, and there's a lot of confusion surrounding this theme of orderliness and symmetry in OCD because, as I said, the media has often portrayed it inaccurately, and not only that, but there's a lot of oversimplification now in the general population surrounding OCD and this particular obsessional theme, because it's become almost part of everyday vernacular. So people will say things like, I need my books in alphabetical order because I'm just so OCD about that. Now, many people are particular about their belongings and kind of the way they live their life, and that's absolutely fine. But in people with OCD, this need for preciseness and exactness is excessive and it's debilitating, and it can even involve things like physical injury. So if a person with this specific symmetry theme of OCD, if they have a cut on one arm, they could physically injure themselves on the other just to maintain this symmetry. So as I said, extremely debilitating. And like I said, there's a lot of oversimplification when it's used in everyday vernacular and everyday language. So those are some of the obsessional themes of OCD that have been found in the clinical population. There are many more. Please feel free to do your own research on that. However, the common theme between all of these obsessional themes in OCD, the common thread is that in order to reduce the anxiety caused by these obsessions, people with OCD tend to try and neutralize it or suppress it, these obsessive thoughts, with an action, and these are called, or a thought, and these are called compulsions. Compulsions are the repetitive actions, rituals, or behaviours that are performed in response to an obsession. And these are performed in order to relieve anxiety or even to prevent a dreaded outcome. So compulsions can be external, so visible things done in the outside world, or they can also be internal, so things that someone does in their own mind. And many people with OCD know that their compulsions are often irrational, and they often know that they're not helpful. However, they feel compelled to do them anyway. So I'm going to give you some common examples of common compulsions. For example, checking is one example of a common compulsion. Checking that you didn't harm yourself, checking you didn't harm others, checking a horrible event did not happen and will not happen, checking you didn't make a mistake. Those are some examples of a checking compulsion. Another very common compulsion, as I've mentioned in this video, is washing and cleaning. So an excessive hand washing, excessive grooming, excessive cleaning with like chemicals of your house, and that kind of thing. Another very common compulsion is mental compulsions. So, like I said, the internal ones, and this can be praying in order to prevent harm to another person, cancelling a bad thought with a good one, or a bad number with a good number, and also kind of just counting and ending on a right number and a good number. Those are examples of mental compulsions. And finally, repeating is another very common compulsion. So repeating bodily movements, repeating activities, repeating a mental event. And as I've said a bit earlier on in this video, compulsions can provide a short-term reduction in anxiety. However, actually over time, they increase preoccupation with the obsession that they're meant to be reducing the anxiety for. They actually increase the preoccupation and maintain the pattern of responses to this obsession. So they aren't helpful in the long term. As I said, compulsions can actually maintain OCD. It can keep the problem going. But this is important to consider, because if we can work out what's keeping OCD going, we can also work out how to treat it by intervening into this maintenance cycle, by breaking it up. So, as I mentioned, compulsions kind of help maintain OCD, but there are also other maintenance behaviours involved in OCD. For example, avoidance behaviours. These behaviours can include avoiding certain situations that could be dangerous or that could induce obsessions or compulsions. A lot of people with OCD engage in avoidance behaviours. And another thing is attention and reasoning biases. Now, people experiencing OCD can often experience changes in what they pay attention to and the kinds of conclusions that they draw from certain situations. And this is usually because they pay closer attention because they're dangerous or could lead to an unwanted outcome. And these biases become automatic over time, but they actually maintain OCD because they cause an increased attention and focus on negative stimuli that maintains the OCD and actually reduces the attention on stimuli that could actually disconfirm their obsessions and help with compulsions. So these are the kinds of behaviours that maintain OCD and that we want to interrupt in order to treat it. One theory of OCD, proposed by Psychologists, Forrester and Richards in 1998, suggests that it's not actually the intrusive thoughts themselves that is what's distressing in OCD, but rather the meaning that people assign these thoughts. So the interpretation of the negative thoughts is what's actually causing the negative consequences, such as OCD. For example, a person with OCD may interpret their intrusive thoughts as meaning that they're a bad person or that something bad will happen and that they are personally responsible for this. And once someone interprets this something as personally significant, this increases the likelihood that they're going to perform certain behaviours that will keep themselves safe or others safe. In correspondence with this theory of Psychologists et al., OCD responds really well to psychological treatments, for example CBT, so Cognitive Behavioural Therapy, and ERP, Exposure and Response Prevention. Now, the UK NICE guidelines suggest that a mixture of both CBT and ERP are the best approach to treating OCD, and this would include a minimum of 10 hours with a therapist, which increases depending on OCD severity. So I'm going to go into a little bit more about CBT and ERP now. I'll talk about them separately, but they work best well together. So CBT, Cognitive Behavioural Therapy for OCD, involves the client and the therapist working together to first identify and address their interpretation of intrusive thoughts. So this is the more negative interpretation. For example, I have these intrusive thoughts, these negative thoughts, that means I am a bad person. That's their interpretation. And then after they've identified this original interpretation, the client and therapist work collaboratively to come up with an alternative interpretation of their intrusive thoughts. And this one will be more helpful and less threatening. So for example, I have these negative intrusive thoughts, but that doesn't technically mean I'm a bad person. everyone has these intrusive thoughts, so it doesn't mean that I'm personally responsible. So that could be the alternative interpretation that they come up with, but it's quite a vague one. It obviously, depending on the person, it would change. So this coming up with the alternative interpretation is the cognitive part of CBT, Cognitive Behavioural Therapy. The alternative interpretation is then tested in the behavioural part of CBT, and this involves a process of information gathering, such as symptom monitoring, behavioural experiments, and exposure exercises, and that's what's involved in ERP. So I'll explain what ERP is, as that's often the behavioural part of CBT. So while ERP, exposure and response prevention, is a treatment for OCD in itself, it is most effective when used as the behavioural component of CBT. Now I'll break it up here. So exposure and response prevention, let's start with exposure. Now exposure is an effective treatment for fears. It's been around for quite a while, especially for phobias. Now, when engaging in exposure therapy, the aim of the game is to find an anxiety-inducing situation and stay in that situation until your anxiety is lessened. Now, for OCD, the aim of this exposure exercise is to test the less threatening alternative interpretation that you came up with in the cognitive part of CBT. So, for example, if the alternative interpretation of your intrusive thoughts about getting people sick was that it's going to be your fault and they're going to die. So if you touch the toilet, you're going to get someone sick and they're going to die. That would be the original interpretation. Now, an alternative interpretation that you come up with in CBT would be, if I touch the toilet, someone may get sick, but it's unlikely, and it's very unlikely they're going to die, and it's not going to be my fault, because that's not going to happen. So that would be the alternative interpretation, and you would test this in the exposure therapy session. So you would test touching the toilet, touching someone else, and seeing if they die. I know that's a very morbid explanation. I'm trying to come up with something quite simple and quite fast, but that would be the exposure. It's anxiety provoking because you're touching the toilet and touching someone else, thinking because of your interpretation that they're going to die, but in the same time you're testing the alternative one. So if they don't die, the alternative interpretation, the less threatening one, is probably the best one. So that's the exposure part of it. But then the response prevention part is really important in OCD. So exposure for OCD incorporates response prevention to make it more effective. It's because performing compulsions in OCD actually prevents the individual from finding out if their obsessional worries are true. It prevents them from finding out if they touch the toilet and touch someone else that they're going to die, because you're performing compulsions such as hand washing. You're never going to find out the link. So the part of ERP that's really important is resisting the urge to perform the compulsions. That's the response prevention part. So it's a crucial part of testing the interpretations and overcoming OCD. So the response prevention part in this behavioural component of CBT would be not washing hands. So she touched the toilet, that's the exposure, and touch someone else, that's the exposure therapy. The response prevention would be washing her hands in between. And then hopefully she'd see that the alternative interpretation, that people probably aren't going to die, and it's not going to be her fault if they do die, because people don't always get that sick that easily, that was more likely to be true. So that's the kind of CBT incorporated with ERP approach to therapy that is the most effective for treating OCD and recommended by UK NICE guidelines. While I mentioned that CBT and ERP together are the most effective forms of treating OCD, there are other medical options. So SSRIs, selective serotonin reuptake inhibitors, it's hard to get that one out. They are also known as an effective treatment for OCD, and also are suggested by the UK NICE guidelines if you are looking for a more medical intervention. But as I mentioned, CBT with ERP is the most recommended by UK NICE guidelines as an approach to treating OCD. Now, I hope that this has been a kind of beginner's guide to understanding OCD, understanding the causes, the symptoms, the treatments, and also just in general the prevalence and stuff like that. But if you want to learn more, I definitely recommend this book. It's called Overcoming Obsessive Compulsive Disorder, and it's by David Veal and Rob Wilson. You can get it on Amazon or anyone like that. But yeah, I definitely recommend this book if you want to learn more. It also includes a lot of other kind of examples that are probably better than my morbid ones or my vague ones. So I definitely recommend getting this book, and I hope that this has helped you understand OCD a little bit more. Cheers.